your educator for the TABCARES HIV and AIDS Prevention Program at the University Medical Center of El Paso. Did you know HIV and AIDS is one of the most ignored issues among teens? They believe it will never happen to them, but they're wrong. Throughout this video, I will give you basic information about HIV and AIDS prevention. You will learn how to prevent HIV and AIDS, and also how to successfully use a condom. So let's get started. HIV is the virus that causes AIDS, and AIDS is a result of an HIV infection. Now, HIV can be prevented. You might be asking yourself how. Abstinence, of course, meaning not having any kind of sexual activity, or using condoms. Don't worry, I'll show you how to use one properly later in this video. Now, you're probably asking yourself, what is the course of an HIV infection? Well, people infected with HIV may look and feel healthy for a long time. They can infect others even if they don't look or feel sick. When people develop AIDS, they may have symptoms that are like those of many other illnesses. They may get illnesses that healthy people usually do not get. Only a test can show if you have HIV, and only a doctor can diagnose AIDS. Now, a lot of people believe that HIV can be transmitted through everyday casual contact. They're wrong. You cannot get HIV by sharing the same phone as an infected person. You cannot get HIV by dancing with an infected person. You cannot get HIV by sharing any kind of food or drink with an infected person. And you cannot get HIV by sharing the same toilet as them. Now that I've showed you some specific ways you cannot get HIV, I'll share with you how people can get infected. You can get infected by having vaginal, anal, or oral sex with an infected person, or by sharing needles and syringes with an infected person. Also, during pregnancy, birth, and breastfeeding from an infected mother to her baby. There are 5 body fluids that can infect a person with HIV. Those are semen, otherwise known as sperm, blood, breast milk, vaginal fluid, and anal mucus. Getting homemade tattoos is another way people can get infected with HIV. By using the same needle that was previously used on an infected person is a good chance you will get infected. So be smart. Get a professional tattoo, and don't use your neighbor's. Being under the influence is another way people can get infected with HIV. Being on drugs can make you do things that you normally would not do. How can we stop the spread of HIV? Now, there are many ways you can be affectionate with your partner without having sex. You can give them gifts. Giving letters, taking walks, or as simple as giving them chocolates is a for sure way we can stop the spread of HIV. Also, by abstaining from any sexual activity. Using a condom the right way every single time will give you a good chance that you won't get infected with HIV or any sexually transmitted disease. So now I'll be explaining to you how to properly put on a condom. Now, there are many ways you can put on a condom. There's only one proper way, which is the one I will be showing to you today. For a condom to work properly, it needs to be taken care of, meaning you cannot leave it in your back pocket, you cannot leave it in the car, it can't be reused in any way, and it cannot be ripped or punctured. So let's get started. The first thing you have to do is check its expiration date. Make sure it hasn't expired yet. The next thing you have to do is check the wrapper for any punctures. You must move the condom slowly around the wrapper. Now, the third step is to move the condom slowly to the side so you have room to open the condom. And slowly begin to rip it, making sure that the condom itself is not being ripped. Now, a lot of times, people get excited and they want to do it fast. So they tend to rip it either with their mouth or as fast as they can. This can probably wear itself. So now we're going to start taking it out. Slowly push it out and place it on your finger. Now that you've placed it on your finger, you need to slowly pull it down just a little bit to make sure it is on the right way. Placing it the wrong way on the penis might get some ejaculation on the outside, which can get the girl either pregnant or infected with HIV. So now that you've learned how to make sure it is on the right way, we're going to begin and put it on our demonstration device. Okay, so now, before putting it on the erected penis, you must make sure that there is space between the penis and the end of the condom for the ejaculation to land. You will place it on the top and with your fingers start rolling it down all the way. After the ejaculation is over, the penis is now limp. This is the best time to take off the condom. You must first grab the tip to make sure that no semen comes out, and slowly begin to carefully remove by pulling it, rolling it up all the way, tying a knot to make sure that no fluids come out. And dispose of it. Now that I have shown you how to properly use a condom, remember to use protection every single time. The risk of getting HIV through a blood transfusion in the U.S. is extremely low because all blood donors are screened for the risk of HIV, all donated blood is tested for HIV, and all blood that is donated and tests positive for HIV is immediately destroyed. People who believe they are at risk of HIV or already know that they are infected are encouraged to seek individual counseling and testing. Remember, do not donate blood just to get tested for HIV. To find an HIV testing site near you, click on HIV testing on this website, TABCARES.org, type in your zip code to find the nearest clinic. And remember, everything is 100% confidential. If you would like more information on HIV and AIDS prevention, you can email us at tabcares@umcolpaso.org or call us at 915-521-7482. My name is Nina from the University Medical Center of El Paso, TABCARES Peer Educator HIV and AIDS Prevention Program. Thank you for watching.